Dr. Dara Bushman, a licensed clinical psychologist based here in South Florida, and thank you very much for joining us.
Nice to see you again.
Thank you.
This was such a sad and shocking news. Do you think it's a reminder that depression and suicidal thoughts don't discriminate?
Completely, they do not discriminate. And first, let me say, the word suicide in itself is the worst word in our entire language. It is horrible, just the word itself. And it does not discriminate. Suicide does not discriminate against rich or poor, race, creed. It affects everybody and all of us. And what has happened has affected each of us because we all know somebody struggling or suffering with depression or mental illness, and people who have taken their own lives.
You know, this is a woman who achieved such great success in the fashion world, in the business world. She was also a mom. She has a 13-year-old daughter who now is without a mother. When you talk to patients in your private practice who have had to deal with such a loss like this, especially the loss of a parent, how do you even go about helping them sort of come to some kind of understanding about what's happened and figure out some path forward?
It's really undescribable in a sense because nobody can tell anybody after the loss of a child or a mother or a wife how to express things and what to feel. Every family goes through this in their own way and in their own time. And so that is first and foremost to explain to people, because people think they're supposed to do it in a certain way, and the only way is their way.
And what about people who are you know, struggling with mental illness and depression? You know, if someone's in your family, a lot of people aren't really public about it, but family members usually can see the signs. And what should they be doing to help people, you know, in order to prevent an eventual suicide?
Well, first, noticing the signs like you just brought out: irritability, isolation, talking about hopelessness and not wanting to live. Often people don't come and tell you specifically what their plan is, but noticing what's going on for them and getting them help. There is such a stigma about mental health and suicidality that often we're in denial or we're not willing to take the step to move forward. So it would be consulting with a psychologist or a mental health expert, asking questions. There's a suicide hotline people can call, just asking questions to find out if what their loved one is experiencing is something that needs immediate help.
But what could be the possible reasons? Of course, we don't know what happened here. What could be the possible reasons that somebody with the resources, that someone like Kate Spade, we saw it with Robin Williams, who have the money, the resources to reach out to get help, why in many cases they don't get help?
Fear and the stigma. Because what would people think if they were to reach out? What would people think if they did ask for help? When people are in this position and they commit suicide, they are in desperate pain. They feel that there is no other way or end to put themselves out of the pain that they're feeling, and they don't believe that there is help or hope for themselves. They believe that it's better for their families if they were no longer there.
So sad.
I'm so glad you mentioned the hotline, because there we have it up on the screen and it's available 24 hours a day. If anybody out there, or if you know anybody out there that needs some immediate assistance, call that number. Dr. Dara Bushman, licensed clinical psychologist here in South Florida. Always good to see you. Hope the next time we see you is under better circumstances.
Yes.
Thank you very much.
Thank you.